Hi, I'm Dr. Laura Grashow, a licensed psychologist with drgrashow.com. Please remember that advice from this video is not intended to replace actual psychotherapy. Okay, so now let's talk about helping parents identify ADHD in their children. And right away, I'm going to say it's obviously very difficult for a parent to make this diagnosis. But if, as a parent, you suspect that your child has ADHD, these are the kind of things that you want to look for. The three major areas that we look at are impulsivity, signs of inattention, and hyperactivity. So let me elaborate a little bit. When it comes to impulsivity, we find kids blurting things out, not being able to wait their turn, often pushing and grabbing, maybe doing things that might be perceived as by others as dangerous, such as jumping off of a very high place. And then when it comes to inattention, really having difficulty focusing on anything for a long period of time, except things that are very gratifying, such as a video game. And then in the DSM, it talks about these children acting as if they're driven by a motor. They're in constant motion. Okay, so these are the three core symptoms as a parent you want to consider. Some other things you want to consider are, has this behavior lasted for at least 6 months? Has the behavior been around before age 7? And believe it or not, there are some children for whom parents notice these kind of behaviors as early as in infancy, where they see extended and prolonged crying spells. They're very irritable, difficult to soothe. And then the other thing you want to take stock of as a parent is, does my child stand out from his peers? Is he more active? Is he even more inattentive? Or is he even more impulsive than his peers? Because you want to compare your child's behavior to that of his peers. And as I've said before, when you're talking about young boys or even young children, sometimes parents, in my experience, worry because they think their child is displaying ADHD behaviors, which they may be ADHD-like behaviors, but it really doesn't qualify as the diagnosis.